Right, let's catch up with all things COVID. We had the press conference from the Prime Minister yesterday evening where Boris Johnson said that the NHS is moving to a war footing, but he wants the current Plan B level of restrictions for England to remain the same. He doesn't want to introduce any more restrictions. At this press conference yesterday, he again urged people to get their booster jabs and said there's a good chance of getting through the Omicron wave without any more lockdowns. All of that came as the UK recorded more than 200,000 coronavirus cases in a day for the first time. Nathan Alban has the latest stats for Cambridgeshire. Nathan, good morning. Where are we in this part of the world?
So first, good morning, Dotty. Happy New Year to you as well, if we can keep saying that. COVID patient numbers, let's look at those first. They're the most important ones, especially if we're looking at whether hospitals are getting overwhelmed, which seems to be a bit of a theme across the country at the moment. So Cambridgeshire, currently 159 COVID patients. That's the latest number we have for the 28th of December. That's up by a third on the week before, up from 120. And it's the first real marked rise we've seen in COVID patient numbers in Cambridgeshire's hospitals since around the end of November, when we had a small peak at the start of November and moving down since then, but back up through December. But so 159 is the latest number we have. Bear in mind, this is still absolutely nowhere near the 614 we had in late January last year. So comparing the picture with this time last year, we are a lot better off. But of course, hospitals have that huge backlog of appointments and procedures to get through. So they're under a lot of pressure with COVID and things otherwise. So still important to get those all-important vaccinations and try and stay away from the virus.
Yeah, I think most of us are aware that the case rate, the daily numbers of people catching COVID every day in the UK have been rocketing really over the last few weeks. But the number of people dying from COVID, Nathan, it stayed fairly flat.
Yeah, I think that's fair to say. I mean, obviously through the summer, we were down to really low levels. For example, in the month of May in Cambridgeshire's hospitals, there were no COVID deaths at all. But numbers since then naturally have trickled up a little bit with more people spending time indoors, etc. So the number for October was 44, November 47. And the latest number for December we have is only 24. That's the confirmed number so far. Naturally, it takes a bit of time for these deaths to be confirmed and the numbers to come through. But 24 for December 2021 confirmed so far. Compare that with December 2020 when we were heading into that big third wave, I think it was, of the virus in towards the January lockdown. 112 COVID deaths in December 2020 and just 24 so far confirmed for December 2021. So I think that just about sums up how we're in a lot better position now than we were a year ago in terms of a lot of people being vaccinated, having a bit more protection, and also in terms of the treatments that are on offer in Cambridgeshire's hospitals as well.
Yeah, context is everything when it comes to these numbers. In isolation, they don't necessarily make a lot of sense, but when you compare them to a year ago, say, suddenly it all becomes a little bit clearer where we are. What about local infection rates?
Infection rates, well, just looking at the national picture first, parts of Cumbria now have the highest infection rates in England, coming up to 3,000 weekly cases per 100,000 people. So really sort of exploded in the last few weeks. Our latest data show infection rates went up across most of Cambridgeshire over the last week of 2021. Huntingdonshire now has the highest rate locally. It's the only part of the county with an infection rate above the national average, which you could see as good news, but it's just a reflection really of how serious the situation's got nationally. I think the Hunt's rate is up 41% in a week to 1,679 weekly cases per 100,000 people. Infection rates in Peterborough and Fenland are up by over 50% in a week, but they remain below the national average. Likewise with rates in South Cambs up 7% and East Cambs, which is up by a third. The only part of Cambridgeshire showing a week-on-week fall in the COVID infection rate is Cambridge, down 9% in a week and now ranks in the bottom 15% of England, along with East Cambridgeshire, of course, with schools going back and the virus now spreading into sort of older populations. We'll have to keep an eye on these data and crucially the COVID patient numbers to see the impact.
Yeah, it'd be interesting to see whether the start of the university term makes a difference to those figures for Cambridge as well. And just finishing, Nathan, with vaccination rates.
Yes, so vaccination rates, Cambridgeshire still lagging behind the national average when you look at first and second doses, but I'll bring you some good news to end on, if you like. Parts of Cambridgeshire above the national average in terms of the booster rollouts, and naturally we expect that in the early weeks of the booster rollout, with parts of Cambridgeshire naturally having a older population than the national average and being offered the jab earlier. But now with most people having been offered the booster jab for a good amount of time so far, we expect them to be sort of on an even keel with the rest of the country. So England, 60% booster take-up, South Cambridgeshire, 64%, Huntingdonshire, 62%, and East Cambridgeshire, 66%. Two-thirds of people aged 12 and above in East Cambridgeshire have had their booster, which you can see as great news. On the other hand, though, Peterborough, 43%, Cambridge, 42%, and in Cambridge, still a third of people haven't had any jabs at all.
Okay, Nathan, thank you very much for bringing us up to date with all of that.